Hi, Dr. Tugbiyele here, Urogynecologist, and in this video we're going to talk about abnormal uterine bleeding. This is a condition that affects many women who come to see us, and so we'll just get started on talking about it a little bit. So abnormal uterine bleeding can be a condition that occurs surrounding a woman's period or not necessarily related to the period, and we'll kind of talk about how this is classified. But one way we like to think about it is this bleeding that started acutely, meaning all of a sudden, or is this a condition that comes and goes, it's intermittent, or is this a condition or bleeding that is chronic, meaning it's been abnormal for a long time? And a woman's period can be either irregular in some way, and we say that this is, we call this Metrorrhagia, meaning an irregular period or irregular menstrual cycle. It can be regular but abnormal in a different way. It can be where the period occurs less frequently than typical, spaced out greater than 35 days, for example, and we call that oligomenorrhea. And if this is a period that lasts many days, beyond the 5 to 7 days typical for women, then it's called Metrorrhagia. Again, if it's irregular, meaning doesn't follow a certain pattern, then if it's surrounding the period, it's called Metrorrhagia. And then some women have a combination of things, meaning Metrorrhagia, meaning it's heavy and it's irregular. This is a condition that affects many women, their quality of life, as you can imagine. If it's not scheduled and women don't know what to expect, then definitely it can affect quality of life. And so when we think about abnormal uterine bleeding, there's actually a mnemonic that is quite commonly used to differentiate whether the bleeding is due to anatomic causes or non-anatomic causes, and it's called Pomcoin. And so we'll kind of touch on each one of these one by one. So the P is this a condition due to a polyp? And a polyp is a fleshy extra tissue in the uterine lining, is the simplest way I can put it, that can cause irregular bleeding, spotting in between periods, and it actually can be common in women as women age. And so that's something that's an anatomic reason for bleeding. Or is this due to a condition called adenomyosis? It's similar to endometriosis, but different at the same time, where there's extra bleeding cells that occur that are within the lining of the uterus. And so these are cells that typically would be in the lining of the uterus, but now have found their way in the body of the uterus, essentially. And so women who have this condition, adenomyosis, they bleed more, have pain, and it can cause heavier periods, so to speak. Or is it due to a condition called Lyomyoma or fibroids? And fibroids are extra smooth muscle tissue that occurs in the uterus that can cause bleeding, pressure, pain, painful intercourse. Depending on the location, the number, the size of the fibroids, they can cause pressure on the bladder and frequency, urgency, or pressure on the bowels, and can cause constipation. So that's another anatomic reason for bleeding. And then lastly, malignancy. Unfortunately, some women may have developed a cancer in the uterus, and that can cause irregular uterine or abnormal uterine bleeding, heavy bleeding, or bleeding after menopause, where there should not be any bleeding through the uterus, then women may get some bleeding. And so whether these are anatomic causes, polyp or adenomyosis or fibroids or leiomyoma or malignancy, that's kind of the anatomic reasons that can cause abnormal uterine bleeding. The non-anatomic reasons oftentimes can be either hormonal or they can be something related to bleeding patterns. So there are some women who have something called a coagulopathy, meaning they have a difficulty clotting blood. They bleed and they just cannot stop it. It may be something due to the platelets or clotting factors, or there might be a hereditary condition that may cause a propensity for bleeding, and so that would need to be, of course, worked up. There are some women who have an ovulatory issue, meaning they're not ovulating regularly. They don't have that normal cycle, typically that involves hormones, involves the ovaries and follicles, and because of that, they are not creating enough hormones, estrogen and progesterone, in a cyclical, coordinated fashion. And because it's not coordinated, then the bleeding won't be coordinated, the period won't be coordinated, and then it becomes abnormal, either regular or heavy or a combination of both, or spaced out. Other non-anatomic causes, it may be due to something in the uterus, maybe that is causing the bleeding, or iatrogenic, we say, meaning there's other reasons for bleeding. Trauma to the pelvis can do that. And then there are non-classified reasons where if we cannot put in any particular category, then it gets lumped in that category. So as you can imagine, there are anatomic reasons for abnormal uterine bleeding, and there are non-anatomic reasons. And so when we see women in the office, it has to be worked up. After a thorough history and physical exam, there might be some additional testing or diagnostic work testing that needs to be done, lab work that needs to be done, pelvic ultrasound, other diagnostic tests that may need to be done in order to differentiate whether it's anatomic and anatomic, or non-anatomic, I should say, and what would be the best treatment. And there's so many treatments available where some patients may choose a medication, other patients may choose a procedure to address the bleeding, depending on what's causing the bleeding. Okay, and some patients may require surgery or some sort of corrective process to help to stop the bleeding or to regulate or normalize the bleeding. So there are so many different reasons, and one of the other causes of abnormal bleeding, a lot of women, as they approach menopause, as their hormones start to dip and wane, and this is an ovulatory issue where they don't have enough eggs or follicles to create enough progesterone as they did when they were younger, and so that can cause the periods to be dysfunctional, so to speak, or irregular, and that is a common condition that affects many women in perimenopause, approaching menopause, until the periods finally stop. And then if a woman develops abnormal uterine bleeding after menopause, then definitely that needs to be worked up for different reasons. It may be a polyp, but there also needs to be the need to rule out a malignancy of some sort. And so there are different things that need to be done in order to work this condition up. I like to reassure my patients that they don't have to live or put up with any of these symptoms. They're definitely good options that are safe and effective, and a thorough workup is very important in order to arrive at a correct diagnosis and a treatment plan that works and addresses the issue. And so if you would like more information about this, you can visit my website at drdrsteventugbiyele.com, and there'll be a link attached to this video for that. I see patients in the Metro Atlanta area, and also patients who may perhaps be coming from out of town. Arrangements can be made where you can be seen for a consultation in the office, and those travel arrangements can be facilitated around that visit. I definitely let my patients know that there are good options that are safe and effective, and improving your quality of life is my passion. And so I'd love the opportunity to be able to take care of you and help you live your best life and improve your quality of life. The office number is 470-325-1280. That's 470-325-1280. And my practice website is Northside Center for Urogyne.com. That's Northside Center for Urogynecology.com, and that link will also be attached to this video. Till the next video, thank you for listening, and I hope we can help you. You take care. Be well. Bye-bye.